what's going on? Dr. Tommy Wolf.
I'm Dr. Vanessa Rodriguez.
Today we're going to talk to you about rib pain.
Yes. And when we say rib pain, we typically mean you have some sort of chest pain that that's unexplained. And we're not talking about the heart attack chest pain or the numbness and tingling going down the arm. What we're talking about is that pinpoint pain, whether it's along the front of the chest, along the spine, or it wraps around from the front to the back or vice versa, that you really don't know how it got there. When you take a deep breath, it pinches, it doesn't let you do that. Or when you move around, you feel that sharp stabbing pain in a specific area. All that signifies that you got a rib out.
Yeah, and some of the diagnoses, you have intercostal neuritis. We have a fireman under care that was diagnosed with that, or costochondritis. There's a lot of
fancy names?
Yeah, fancy names and diagnosis you can get, but what it's caused by is the ribs are literally out of place. Now, that could be a rib, an anterior rib, meaning in the front, off the sternum, that needs to be put back in place, or it could be from the back. So if you want to test yourself and see if if your sternum pain is due to rib, go ahead and press on it, and if you feel it all the way in the back, then that's the rib. Mm-hmm. So one of the things we look for is, well, how is it aligned? Right? The rib attaches to the vertebrae in your spine, to the transverse process and the body, and if you've had some sort of trauma in the past, you might probably not even think it was related to it.
Right.
It could have threw your spine out of alignment and it pulled the rib with it. Mm-hmm. Now, that could cause many symptoms, from the back rib pain to the front rib pain to the side rib pain, and the best thing to do is to get in there, see what rib it is, and put it back in place. Because again, it's going to affect your breathing, it's going to affect a lot of things.
Right, so some ways that you can test it or maybe even alleviate some of the symptoms are doing the foam roller on your back, stretching out the chest, stretching out the spine, maybe getting a tennis ball and rubbing out that specific area. You can go up against the wall or on the floor. But really, if that doesn't seem to help it and you are having this pain for a few weeks, if not longer, definitely getting it checked out through a chiropractor, through a specialist that knows how to adjust those back into place, will be your best bet.
I thought you were going to say something else.
Anyways.
But hey, go ahead and if you have any more questions, go ahead and reach out to us.
www.thenewhealthcc.com.